In today's presentation, we will explore a multifaceted intervention aimed at addressing homelessness in our community. Homelessness remains a pressing issue affecting individuals and families across diverse backgrounds. Our intervention seeks to provide holistic support ranging from immediate needs such as emergency shelters to long-term solutions like employment assistance and mental health services. Grounded in ethical principles, including Social Work Disposition 7, our approach prioritizes the well-being and dignity of homeless individuals. Through collaborative efforts and evidence-based strategies, we aim to create meaningful and sustainable change, ensuring that everyone has access to safe, stable housing and support they need to thrive. Describe the intervention. Homelessness is a multifaceted issue that requires a comprehensive intervention approach. Firstly, addressing the immediate needs of homeless individuals is crucial. This involves providing emergency shelters, hot meals, and across to healthcare services. Transitional housing programs can offer temporary accommodation while individuals work towards securing stable housing. Furthermore, addressing the root cause of homelessness is essential for long-term solutions. This includes tracking issues such as poverty, lack of affordable housing, unemployment, mental illness, and substance abuse. Economic empowerment initiatives, job training programs, and mental health services can help individuals regain stability and independence. Collaboration between government agencies, nonprofit organizations, and community groups is vital for effective intervention. Coordinated efforts can streamline services, avoid duplication, and maximize resources. Additionally, raising public awareness and combating stigma surrounding homelessness are important for fostering empathy and support. A primary goal of interventions for homelessness should be to ensure that all individuals have access to safe, stable, and affordable housing. This can be achieved through a combination of short-term and long-term strategies. In the short term, the goal is to provide immediate assistance to homeless individuals by offering emergency shelters, food, healthcare, and other essential services. Simultaneously, interventions should aim to address the root cause of homelessness, such as poverty, lack of affordable housing, unemployment, mental illness, and substance abuse. Long-term goals include implementing sustainable housing solutions, enhancing economic opportunities to provide access to mental health services, and strengthening community support networks by addressing both the immediate needs and underlying factors contributing to homelessness. Interventions can work towards the overreaching goal of ending homelessness and ensuring that everyone has a place to call home. Goals for intervention. Increase the number of homeless individuals access stable housing by 20% within the next 2 years through the implementation of Housing First programs, rapid rehousing initiatives, and supportive housing models. This objective aims to provide immediate and sustainable housing solutions to individuals experiencing homelessness, thereby reducing the overall homeless population and promoting stability and independence. Enhance employment opportunities and economic stability for homeless individuals by facilitating job training programs, vocational skills development, and access to employment resources. The objective is to increase the employment rate among homeless individuals by 15% within the next 3 years, thereby empowering them to secure stable income and transition out of homelessness. By addressing economic barriers and promoting self-sufficiency, this objective contributes to long-term goal of ending homelessness and promoting socioeconomic inclusion. Outcome objectives. Establish partnerships with local government agencies, nonprofit organizations, and community stakeholders to enhance coordinated and collaboration in delivering homelessness interventions. This process objective aims to facilitate information sharing, resources pooling, and joint decision-making to optimize the effectiveness of interventions. Develop and implement a comprehensive outreach program to identify and engage homeless individuals in need of assistance. This involves training outreach workers, establishing outreach teams, and conducting regular outreach activities in areas with high rates of homelessness. The objective is to increase and reach the accessibility of support services to homeless populations who may be reluctant or unable to seek help on their own. Resources needed to initiate the intervention. Initiating interventions to address homelessness requires a diverse range of resources to effectively meet the needs of homeless individuals and implement comprehensive strategies. These resources include funding, physical infrastructure, human resources, partnerships, education materials, and technology. Allocating sufficient resources across these areas is essential for initiating and sustaining effective interventions to address homelessness in communities. Research methods needed for conducting evaluations of the planned intervention. Conducting evaluations of interventions to address homelessness requires a combination of quantitative and qualitative research methods to assess the effectiveness, impact, and outcomes of the intervention. Here are some research methods that could be suggested. Surveys and questionnaires. Quantitative surveys can be administered to both homeless individuals and service providers to gather data on demographics, housing status, service utilization, satisfaction levels, and perceived outcomes. Interviews and focus groups. Qualitative interviews and focus groups can provide in-depth insight into the experiences, needs, challenges, and perceptives of homeless individuals, service providers, and community stakeholders involved in the intervention. Program records and administrative data. Analyzing program records, case files, and administrative data can provide quantitative data on service delivery outcomes and housing placements, employment rates, and other relevant indicators. Conclusion. In our intervention to address homelessness, we are committed to upholding Social Disposition 7, social workers' ethical responsibilities to clients. This standard emphasizes the ethical obligation of social workers to prioritize the well-being, dignity, and rights of clients. As we engage with homeless individuals, we recognize the importance of respecting their autonomy, promoting self-determination, and ensuring culturally competent and client-centered services. Our approach prioritizes building trust, fostering meaningful relationships, and empowering clients to actively participate in decision-making processes regarding their housing, support service, and overall well-being. By adhering to these ethical responsibilities, we strive to uphold the highest standards of professionalism and integrity in our interactions with clients, ensuring that their needs and interests remain at the forefront of our intervention efforts.